My name is Kaylee and I'm going to speak to you about safely formula feeding your baby. There are two types of infant formula, a ready-to-feed liquid which has been pre-prepared and is more expensive, and a dry powder formula which is more cost-effective and prepared before a feed. Always read the instructions and prepare formula as per the manufacturer's guidelines, making sure to use the exact volume of water and formula that is required for your baby's age. Speak to your midwife or public health nurse if any advice is required. To prepare a feed, wash and sterilise all equipment for the first year of your baby's life. Start by cleaning down all your work surfaces and hands. Fill the kettle with 1 litre of freshly drawn tap water, boil it and leave it in the kettle to cool for 30 minutes. This ensures it remains at a temperature of 70 degrees Celsius, which destroys any potential bacteria in the formula. Pour the correct amount of boiled water into the sterilised bottle and double check the level, ensuring it is correct. Add the formula to the water using the scoop provided, level it off with a knife and add it to the water. Add the exact number of scoops to the water as per instructions. Reassemble the bottle and place the cap on tightly. Roll the bottle to mix the contents and ensure the powder has dissolved. Test the temperature of the milk by placing a few drops of milk on the inside of your wrist. It should be lukewarm but not hot. The feed can be cooled by holding the bottle under a cold running tap or leave it standing in a bowl of cold water until it's cooled. To heat up your prepared feed, place it in a bowl of warm water and check the temperature before you use it. Discard unused milk after 2 hours of it being prepared. It is considered best practice to prepare a fresh feed each time you feed your baby. Your baby should increase feeds gradually every day. At 1 week old, your baby should take 3 to 4 ounces, which is 90 to 120 ml of formula, every 3 to 4 hours.
Hi, my name is Dawn and I will be talking about the importance of safe sleep for your baby. Safe sleep practices are important to reduce and prevent the risk of sudden infant death syndrome. For the first few weeks, babies tend to sleep 10 to 18 hours a day. This is completely normal. Babies should sleep in their own cot, in their parents' room for the first 6 months of life. This is safest. They should sleep on a firm, well-fitting mattress that fits the cot correctly, and stuffed animals, toys, bumpers or anything else should be kept out of the cot. Keep the cot away from drafts, direct sunlight and radiators to avoid baby getting too hot or too cold. The temperature should be kept between 16 and 20 degrees. Babies should always sleep on their backs with their feet to the bottom of the cot. Remember, back to sleep, feet to foot position. Blankets should be tucked loosely but securely, coming no higher than the baby's shoulders. We recommend cellular blankets, which have tiny holes in them that allows air to circulate so that babies do not get too hot. We do not recommend sleeping in the same bed as your baby. However, if you do bring baby into your bed, keep them away from pillows and adult bedding. Never ever sleep in the bed with your baby if you or your partner have consumed alcohol, drugs, medication that helps you sleep heavily, or have smoked. Remember, check on your baby regularly to ensure they are sleeping comfortably and safely.
put your cold water in first, you add your hot, you just check it with your elbow. If it's comfortable for your elbow, it's fine for the baby. It's about 36 degrees centigrade, the water temperature. You put your hand underneath the baby's head like that. You just took the baby under your elbow resting on your hip. Now I'm holding the baby in the same position and I'm going to wash the baby's hair. So just wash it nice and gently. This is a very good baby. And I'm going to come back onto my mat and I'm going to lie the baby back down and I'm going to dry the baby's head well. Babies lose a lot of heat from their heads, so make sure that you dry the baby's head very well. Now, when you're lifting the baby into the bath, just turn the baby over on its side, over in this position. Just put one arm, your left arm, underneath the head and hold on to the left arm. And put your right arm underneath the bottom and hold on to the left leg. Now you see there is no way this baby's going to fall on me. I've got the head well supported, my arm here on the left, and I've got a good grip of the baby. Nice and gently, now nice and gently you're going to let the baby into the bath. Just, if the baby's enjoying it, of course, just leave them in for a little while. Babies are very used to water from being inside, so they love the sound of the water. I'm going to lift the baby out again. Now you see I'm lifting the baby out nice and gently. Now, see, you settle them down, give them a little cuddle, settle them down, and then you're going to dry the baby off well. Don't forget areas where they can get sore if you leave them wet. All babies are quite fat in here, so get right in there under the chin, because if you leave areas wet, they're going to get red and sore. They're all get right onto the armpit here, where they're like that, and another areas get right onto the behind the knees and in the groin area. They're areas that can actually get sore if you leave them wet. So you make sure that you dry those areas off very well.